severe sepsis. Is it clear? And then later on, after severe sepsis, you have septic shock. Is it clear? Septic shock is when you have already hypotension, and hypotension is described as when the mean arterial blood pressure is less than 72 beats per minute. Is less than 72 millimeters of mercury. Sorry. So if you have a mean arterial blood pressure of less than 72 millimeters of mercury, is considered to be hypotension, and that mean arterial blood pressure is going to be calculated as 2/3 the diastolic blood pressure plus 1/3 the systolic blood pressure. That is how we calculate the mean arterial blood pressure. Either you calculate it with 2/3 diastolic blood pressure plus 1/3 the systolic blood pressure, or you calculate it with the formula that says that with diastolic blood pressure plus 1/3 the pulse pressure. Is it clear? It is or you can calculate the mean arterial blood pressure to be equal to diastolic blood pressure plus 1/3 the pulse pressure, and the pulse pressure is equal to a systolic blood pressure minus diastolic blood pressure. If you do that very well, you're still going to end up by having 2/3 the diastolic blood pressure plus 1/3 systolic blood pressure. Generally, that's how you calculate the mean arterial blood pressure. Now, another element, so that is the general definition of hypotension. Now, if you want to use systolic blood pressure and diastolic blood pressure to define hypotension, you can say that hypotension is defined as when the blood pressure is less than 90 all over 60 millimeters of mercury. Is it clear? So every time you have a blood pressure of less than 90 all over 60 meters of mercury, is considered as hypotension. So if you have a patient that has sepsis plus this hypotension, is considered to be septic shock, and there are complications under septic shock that can result. We can have AKI, so you can have an acute kidney injury, you can have pulmonary failure with an acute respiratory distress syndrome at the level of the liver, so it can affect the kidneys, can affect the level of the lungs, sorry, it can affect the lungs, resulting in respiratory failure with acute respiratory distress syndrome. It can affect the liver, resulting to the liver failure. It can affect the liver, resulting to liver failure. It can affect the next one, which is the hematologic system. Is it clear? And when affect the hematologic system, it can result to anemia. Is it clear? In patients, it can result to disseminated intravascular coagulopathy. Is it clear? It can result to disseminated intravascular coagulopathy, and can also result to lymphopenia and all those type of things in the hematologic system. So generally, those are how the sepsis is going to affect the different systems. Is it clear? Now, you can have, apart from sepsis with septic shock, we can have also another pathophysiology, which is septic embolization. Is it clear? Meaning that what? The vegetation of the microorganism are embolized to another tissue. Is it clear? So you can have also septic embolization, meaning that what? From the local spread, those microorganisms can enter into the blood and embolize to the systemic circulation, and particularly this is occurring in patients that are immunosuppressed. Is it clear? When patients are immunosuppressed, can easily have that septic embolization. So in the cases of fruits, this is a local to the systemic spread of the vegetations. Is it clear? And this is what can result to an infective endocarditis, particularly in patient that has a structural abnormality of the heart. Infective endocarditis do not occur in patients that do not have any structural abnormality of the heart. It occurs in patients that have structural abnormalities of the heart. So now, after having that septic embolization, you need to know where are the different organs where there is usual septic embolization. The first organ that you can have septic embolization is the brain. The second organ that you can have septic embolization is the kidneys. The third organs, you have the joints. Is it clear? So the brain, the kidneys, the joints are organs that you can have septic embolization. Generally, when there is septic embolization, they are going to affect those organs. Is it clear? Now, other organs, you are going to have the heart, and the heart is going to be in case of a structural abnormality of the heart, like in a congenital heart disease or a valvular heart disease. If you don't have any structural abnormality of the heart, you are not going to have an embolization there. Is it clear? So those are the different things that you have to put in mind when you have embolization. Now, after visualizing this, we can also note that you have another complication at the local region, which can be ulcers. Is it clear? And the complication at the local region, which is ulcer, you're going to see it in another tutorial called infected ulcers. So from here now we continue now with the clinical presentation of a patient that has infection.